What we're going to look at now is more needling technique and some health and safety aspects with regards to acupuncture. So that's what I'd like to introduce you to today. So it's just to ensure that once you start to needle, you're going to be safe in practicing what you're actually doing. As you notice, I'm actually wearing gloves. It will vary depending on what country, what part of the world you're actually in, will determine as to whether you need to utilize gloves or not. So you would need to comply, so in other words, certain countries in Europe such as Bulgaria, gloves needs to be worn. Parts of America, you need to wear gloves, and same again with parts of Canada. Here in the UK, again, depending on where you train, will also determine as to whether you need to utilize surgical gloves. In addition to that, it is important to note cleaning the skin prior to treatment is important. Is to make sure the surface of the skin is clean. Here in the UK, again, you don't necessarily need to swab the area prior to actually any treatment. There are different methods of swabbing the area. You can use your wipes. There's different types of skin cleaner. Otherwise, you can use your surgical spray, such as your Chlorhex, which is particularly for skin, and that will help with regards to cleaning area before actually needling. So again, that will actually vary depending as to what region of the world you're actually practicing from. So you do need to comply with that. Coming on to needles, again, the needles are going to vary depending on what you're actually treating, where you're actually treating. So let's say if we look at the needle lengths, for example, you've got small needles as short as your say 13 mil in length, and you can go as far, this is a 75 mil length needle, so again they can go up to 100 mil and longer, but that's all going to depend on the individual that you're actually treating. The most common length needle is your 25 mil. Now, besides the length of the needle, needles comes in different thickness. Again, the gauge of the needle, it can be anything from 19, which is mainly used by Japanese acupuncturists, which is quite a fine needle, and it can go up to as much as 30. So they're the more common region in which the thickness of the needle is actually used. Again, for a strong stimulation, you're going to use a thicker needle. If you're wanting a more gentle parasympathetic approach, then you're going to use quite a finer needle. So let's say, for example, which you'll get onto at some point, is periosteal pecking. So that's where you'll take the needle through the skin down to the bone, and you'll periosteal peck at the peritoneum of the actual bone. And in doing that, what you'll basically find is you use a 30 gauge needle, it's going to be a stronger stimulation. And again, if you're going into muscles, tight muscles or anything like that, then again you may well want a thicker needle to do that. Particularly if you're using a long needle, because as you start to drive that needle in, it will start to bend and flex and it won't go in as smoothly. So therefore, your thicker gauge needle will allow it to be a little bit firmer and more rigid as it actually goes into the area. So the gauge of the needle is just as important as to the length of the needle, depending on what you're treating. Bigger the person, and again, if they're holding a lot of adipose tissue, then again you may well want a longer needle to get down to the structure in which you require to get down to. So let's now look at more your needling technique and also taking the needle out of the wrapper. Now, this is the first part where some colleagues will tend to struggle with that. It is important that they all come in single-use bubble wrap wrappers, and they're sterile. So always check the wrappers. The quality of the needle is important. There are a range of companies that supply needles. You've got Syrian needles, they're high quality needles. Some of those have got coatings on, particularly if you're going to do electroacupuncture, you need to be aware of that coating, because that can have an effect with the electro. I use, one of the needles that I tend to use is Phoenix needles. I found them very good quality, very competitively priced. So that's something you need to look at. The cheaper the needle, the less quality it's going to be. And again, if you was to look at the needle, the end of the needle under a microscope, you might find little small spikes. So therefore, as you drive that needle into the skin, you may well find the skin may react to that, patient might feel more pain and discomfort, and also the skin may well grip onto that needle. However, you find the better quality, such as your Syrian needles where they're coated, your Phoenix needles, you find the needle will glide in that much more smoothly, and there's less gripping from the skin and the underlying muscle, mainly because you're not irritating. One of the key things to bear in mind is your needling technique. Main things to consider when needling: it needs to be a painless experience for the patient. You're not wanting to cause pain. If you cause pain during a needling procedure, it affects the limbic system. And it also affects other areas of brain, because what that basically do is pain actually cause the patient to become more anxious, and it can have more of a sympathetic as opposed to a parasympathetic response, and that's in most cases isn't what you're actually looking for. So the more smoother, less pain, less discomfort, the better it is for the patient. So your needling technique is quite important as how you actually go about that. So let's look at taking the needle out of the wrapper. So first things first, put the needle onto the side. So don't hold it upright, keep it on its side, and then peel the top layer and the bottom layer away. As you can see, with a needle, it has a little fastener in the top. So what you want to basically do there is to keep the needle onto the side, grip both the needle and the fastener, take the fastener away. So now I can grip the needle and the tube. Okay, so now I've actually got both the needle and the tube in one hand. Now I'm going to utilize this. I know this isn't an individual, but it'll demonstrate as to what we actually want to do. So as I said, initially you may well wipe the area before you're needling. Make sure you've located your point. Once you've located your point, then what you're going to do is to put the tube onto the surface of the skin. Now when you come to practicing, particularly during the practical session, what many of you are going to be doing with your colleague is putting it nice and gently. One thing to bear in mind, the more gentle you are with the tube, the more discomfort. In other words, when you tap the needle in, you need to push down firmly on the tube. So that's going to be quite important. Push down firmly on the tube. So ensure that when you tap the needle in, it ensures that the needle is going to penetrate to a certain depth. Now, so you push down firmly on the tube, grip the tube with one hand. The hand that you're going to use to tap the needle in, that should be free. As you can see, the needle is just still poking out the top. And what I'm going to do is to pat a quick tap, yeah, and make sure my finger now comes in firm contact with the tube. So let's do that. So that's a nice firm tap. That means that the needle is going to penetrate the skin as quickly as possible. If it doesn't penetrate the skin quickly and it just ends up partially into the skin, that's going to cause the patient discomfort. So being gentle is going to cause more discomfort. Being firm but gentle is going to cause the patient less discomfort. So that's just something to bear in mind. So now what I'm going to do is to take the tube away. So I need to have my finger ready to ensure that I catch the needle. Yeah. Now the important thing is, let's say if the needle is going to flop, you need to make sure you catch it on the handle and not on the shaft of the actual needle itself, purely because if you touch the shaft, that is the part that's going to actually go into the body. So let's take a look at that. So I'll take the tube away, and my finger's there. So as you can see, this needle is standing nicely and firmly upright into the area. So what I'm going to basically do now is to take hold of the needle, and I'm going to rotate it nice and gently until I get it down to the required depth. Now, how deep do you actually go with the needle? You do not go right the way down the full shaft of the needle. You should go at the most, you want to go 2/3 of the length of the needle, no more than 2/3 of the length of the needle. So you should have still a reasonable amount of the shaft out of the area. So when I'm saying 2/3, I'm not on about the full length including the handle, I'm purely talking about the shaft of the actual needle. So you should have a reasonable amount still poking out, so that if there's any stuck needle, you've got something to grip hold of if the handle was to break off. With your new current needles, that shouldn't happen, but you know, there is that slight possibility of something such as that taking place. Now when we come to take the needle out, You grip the needle, you can do a slight rotation, or you can put your fingers at each side, push down firmly, and then just take the needle out. Once the needle actually comes out, it goes straight into the sharps. You have your cotton wool ready, and then what you basically do is you'd apply the cotton wool and put some firm pressure onto there. If there's any bleeding or a little bleb of blood, then you can apply that. Now, if there's no blood, that can go straight into the bin. If there is any blood or fluid onto there, it goes straight into your surgical bin to be disposed of. So once you've actually done that, what you basically then do is to advise the patient of any adverse reaction that may well take place. If there's any blebbing or any bruising that may well take place, advise the patient they may well feel a little bit drowsy, they may well get more pain or discomfort before things start to settle down. So those kind of things you do need to advise the patient, and therefore at least the patient can go and be more aware as to what reaction they may well expect from the actual acupuncture itself. So again, as I was saying, if they're feeling drowsy, make sure they don't jump out your chair and start driving home. So make sure they're going to have a bit of a rest in the clinical area until they feel a little bit better before they actually go. But also what you may well find is some patients may well get home and find that they start feeling tired and want to go to sleep. So you can advise them of those as well. So that's generally our needling health and safety. So you can practice that on your colleague, on yourself, or whatever it may be, but we'll get plenty of practice once we actually get into the practical session. And again, you can watch this section over and over again just to make sure that you get your needling technique off to a flying start in that respect.